Welcome Nick and everyone who is watching this video. I'm glad to be here presenting the results of my analysis for the influenza season preparation. Few introductions, so you can call me Kliba and these presentations will take no more than 10 minutes. The current situation. The United States have an influenza season where more people than usual suffer from flu. Some people, particularly those in vulnerable populations, develop serious complications and end up in the hospital. The objective of this project is to provide information to support the medical staffing agency to determine when to send staff and how many to each of the 50 US states. The medical staffing agency will provide the temporary staff to hospitals and clinics that need additional staff to treat extra patients. The medical agency covers the hospitals and clinics in all states in the US, and this preparation will be for the upcoming influenza season in 2018. In summary, I'll be presenting information related to the number of Americans who died from flu in 2017, how the vaccination rate of children under 5 years old was in the same period, and how children vaccination may reduce death from flu. The analysis. I initiated this project with a hypothesis saying that if states have high flu shots for children under 5 years old, then influenza death will reduce. The hypothesis was tested and confirmed. Statistics tests were applied in a dataset with more than 28,000 vaccination records, and more than 55,000 death records from flu were considered as well. All the dataset used in the analysis came from Census and CDC, and the references will be attached in the project documentation. A question. Have you got an idea how many Americans died from flu in 2017? A total of 55,672 deaths. It means one American for every 5,800 died. California and New York were the states where more deaths occurred in total, but not proportional to the dimension of the states. Proportionally, we can see here Hawaii, Mississippi, and South Dakota. These were the states which had the highest number of deaths to the housing population, that is, the number of inhabitants. And Hawaii is the states with the highest number of deaths per inhabitant. Proportionally, New York is in the 8th position. New York here is in the 8th position. And California is a bit far from the top 10 states with the highest death rate. Although they did not top the 5 highest death rate states, both should be considered as critical because their number of deaths in total is high. So let's see how the children were vaccinated in the same period. This is the number of children vaccinated per state in 2017. Look, the states with the highest number of children vaccinated were Texas, Pennsylvania, and New York, with a substantial advantage for Texas. One key important point to remember is that they are not the states with the highest vaccination rate for children under 5 years old. They are not among those with the highest flu mortality rates. Conversely, Mississippi, Hawaii, and South Dakota were the critical states with the highest death rate proportionally. This another chart. This is an interesting dashboard that shows us the number of children vaccinated in 2017 on the x-axis and the death rate from flu per state in the y-axis, considering the size of each state. The downward trend line confirms that the greater the vaccination, more children vaccinated, the lower the number of deaths. Further analysis will be required to analyze outliers or some specific case. So, a recap to move to the presentation, to our conclusions. The population in the period was 325 million US people in 2017. From those, more than 23 were children from 0 to 5 years old. More than 55 deaths and only 11,000 children vaccinated. So 1 American for every 5,800 deaths died from flu. 1 American for every 5,800 died from flu. And moving as a conclusion and recommendations, the data suggests that Hawaii, Mississippi, and South Dakota, here in the first line, should receive additional resources to fight the flu virus because they are the states with the highest death rate proportionally. Hawaii is the top one place with the highest death rate, and it is a place that offers great challenges for displacement. So it's recommended to set up a special work team with hospital nurses, physicians, and medical staffing administrators dedicated to support this state. In the third line, California, New York, and Florida provide additional resources to these states because they were the states with the highest number of deaths, and then prioritize the allocation of resources for other states following those with the highest number of deaths to the lowest. And finally, investigate why some states had high flu vaccinations but they also had the number of deaths above of average. One example is New York. And conversely, understand why some states had few vaccines and also few deaths. This is the end of my presentation, and now the 30-minute QA session is open. Thank you very much.